Welcome to this week's Healthcare Cybersecurity News Roundup from Hill Security Dispatch. For the latest threat, risk, and alert intelligence, subscribe to our daily curated news and information service at hillsecurity.com. In a move that demonstrates the risk to healthcare firms of using online user tracking tools, as well as regulators' intention to enforce data privacy rules, the U.S. Federal Trade Commission has issued a $1.5 million fine and its first-ever enforcement notice against GoodRx, a telehealth and prescription drug provider. The FTC has filed an action against the company, accusing it of failing to notify its customers of an unauthorized disclosure of their protected health information and permanently prohibiting it from sharing consumer health data for advertising purposes. The suit alleges that GoodRx repeatedly revealed customers' personally identifiable information, including prescriptions and medication purchasing history, over a 4-year period as a result of its usage of pixel tracking technologies from Meta, Google, Criteo, and other firms. And it further claims that the company uploaded customer contact details to Facebook and Instagram for the social media giants to target them with health-related advertisements. To avoid suffering the same fate, healthcare firms, from hospitals and specialty clinics to physician groups and their supply chain vendors, are strongly advised to check that no personally identifiable information is shared with pixel tracking vendors. One issue that healthcare security teams constantly face is persuading their management and C-suite colleagues of the need for investment in cybersecurity to protect patient records, clinical data, and medical devices. However, they often don't have the necessary information to report on the operational, financial, and reputational implications of cybercrime attacks, nor the intelligence to anticipate and mitigate against them. The healthcare sector is currently overwhelmed by the mass of raw data on the cyber threats that it faces, which has led to information overload and decision-making paralysis. It's clear that raw data isn't enough for them. They need actionable intelligence, situational-aware insights that enable them to reduce threat detection and response times, and prioritize protecting their core business operations. To achieve this, the healthcare industry must firstly gather, analyze, and categorize all relevant cyber threat, risk, and attack data before refining it into actionable insights. And those insights should be delivered directly to all the individuals that have responsibility for and are impacted by cybercrime, including management and C-suite executives. That will not only transform cross-organizational cyber intelligence reporting, but streamline communication, accelerate decision-making, and enable investment where it's needed, freeing them to focus on their most important function, protecting the patients that they are there to serve. A new report has revealed that 98% of U.S. firms, including healthcare organizations, have business relationships with a third-party vendor that has experienced a data breach within the last 2 years. This aligns with previous studies which identified that most of the top 10 largest healthcare data breaches in 2022 originated from cyber attacks on third-party suppliers. As most healthcare providers rely upon a complex supply chain to meet their digital, operational, and logistical needs, it's imperative that their vendors and business partners implement and maintain stringent cybersecurity standards. At the recent HIMSS Healthcare Cybersecurity Forum, panelists discussed the challenges of managing third-party risk and suggested a model of constant surveillance instead of transaction-by-transaction assessments. Additionally, healthcare organizations are advised to obtain a comprehensive overview of their supply chain ecosystem, collaborate with vendors to improve their security protocols, and employ automation to continuously review vulnerabilities and monitor their performance. Cybercrime is currently growing at 15% year-on-year and is predicted to inflict damage totaling $8 trillion globally in 2023, which would make it the world's third largest economy after the US and China. The healthcare industry's reliance on digital technologies to deliver services, store data, and transmit records has made it a prime target for ransomware cybercriminals. In 2022, the average cost of healthcare cyber attack was $10.10 million, the highest of any industry sector. Despite spending $65 billion on cyber defenses over a 5-year period, a staggering 93% of U.S. healthcare organizations experienced a data breach, an increase of 58% between 2019 and 2020 alone. And recent research has indicated that U.S. healthcare organizations continue to have a greater than 90% probability of experiencing some form of cyber attack each year. This has been attributed to outdated IT systems, a shortage of cybersecurity professionals, the breadth and depth of the data held by providers, and the urgent need for victims to pay ransomware demands to regain control of essential patient records and clinical data. Whatever the cause, the need is clear. The entire healthcare sector requires real-time, actionable intelligence on cybercrime activity, similar to what's already happening in the financial services industry, to proactively protect itself and thwart the cybercriminals lurking in the shadows. Alongside vulnerabilities in IT infrastructure, data storage systems, and connected medical devices, healthcare firms also have another cybersecurity issue to contend with: fraudulent instruction scams. According to a new report, incidents of such scams, in which cybercriminals use hacking and phishing techniques to gain information that enables them to send plausible-looking requests to transfer funds to bogus accounts, were up by 13% in 2022. Aside from the financial damage that such scams can cause, healthcare providers must also ensure that individuals' personally identifiable information or protected health information has not been revealed. The report warns that current trends indicate that threat actors will continue to pursue fraudulent instruction as a profitable tactic in 2023. But also advises that data exfiltration has become a part of the threat actor's playbook, with all but one cyber extortion incident in Q4 2022 employing that technique. And it continues by stating that extortion techniques are evolving and multiple threat actors can be involved in an attack. Even with proof of deletion, your data may still be out there in other threat actors' hands, exposing your organization to legal and reputational risks. And then there's the danger of significant fines and penalties from increasingly vigilant regulatory authorities, as well as multiple class action lawsuits by victims. The conclusion? Firms across the healthcare sector need to be especially attentive to such scams and ensure that the security of their finance and administrative teams isn't overlooked in the urgency to protect their clinical functions and the safety of their patients. Thank you for your time. I'm your host, Kurt. To receive the latest healthcare cyber threat, risk, and alert intelligence, subscribe to our daily curated news and information service at healsecurity.com.